I think most clinicians see medication overuse as a challenging type of headache. It's very common in tertiary headache centers. Anywhere from 40 to 80% of patients coming into those centers are considered a medication overuse headache. So what we did that was very unique in this study, and this was in PROMISE 2, because technically you can only have medication overuse headache and chronic migraine, is we actually trained the investigators in the study to understand and diagnose medication overuse headache. And then more importantly, we gave them a worksheet which defined all of the ICD-H3 beta, at that time was what we were using, criteria to define that. And they had to sit down face-to-face with each patient, take this history of their medication overuse, obviously with chronic migraine, and then they had to sign whether or not this person had made criteria for diagnosis of MOH. And I think that was something the FDA took note of, because they actually put that on our package insert, that we allowed patients with a dual diagnosis of chronic migraine and MOH in the study. And I think we were unique in doing that. So here again, we were hopeful that we would have some impact on this population. That's why we included it. But what we found is that once diagnosed, we did not do anything to manage that patient. We didn't give them guidance or counseling on their acute medication use. We didn't educate them about what this is. That wouldn't have been fair to the study, but we just observed them. And what we found is that they had just a rapid reduction, obviously in headache days, migraine days, but headache days here, and the use of their medications. And such that by month 1, 50% of this population of medication overuse, first of all, there's 40% of the population in our study was MOH. And of that MOH population, half of them were below the quantity limits for MOH drugs. And also they rapidly got below the threshold for 15 days of headache for the threshold of chronic migraine. And the amazing thing is, and again, this is maybe part of this rapid response, that if you looked out at month 1, those who were successful as 50% responder group sustained that response all the way out through 6 months, 5 to 6 months. So for every single month thereafter. And that to us was a very exciting finding as well. And it makes sense, they reduced their headaches, they needed less medication. The medication, which was the driving force or catalyst for their migraine, is being reduced. And what you see is once that occurs, for a good number of these patients, they actually sustain that through the entire study time, which was 6 months, the duration of the study.